So hi there, Dr. Saxinger. Let's get right to the very first question. If you have recovered from COVID, can you stop social distancing?
That's a logical question. Theoretically, we think you should be potentially immune, at least for a period of time, but I think there's some benefit to obeying the rules and being seen to be obeying the rules, because if you're out in public and there are people not distancing, it could be upsetting to others. And so until we have an official recommendation, I would say we should continue to observe social distancing in case you're not immune, and also to be a good example.
Okay, this next one is kind of interesting. What happens if a pregnant woman contracts COVID?
Yeah, that's an interesting thing as well. We're coming up on 6 million cases worldwide, and there has not been a strong signal of a particular worse disease or pregnancy outcome issues so far. So if there is an effect, it's probably not really large. I did see one study of 400 pregnant women with an ICU admission rate of around 10% and a death rate of 1%, and that's not too different than we'd expect. We also haven't seen any strong signal of problems with the developing baby, which is reassuring, but we do have to watch out for problems like premature labor, which could be a consequence of illness in pregnancy.
Okay, here's one that's pretty practical. We're reminded often on the proper use, removal, and cleaning of our non-medical masks. However, there's never a mention of our glasses. Should there be a similar protocol?
That's interesting. I think the difference to me is that a mask is actually filtering air and is a place where we think virus could theoretically collect, actually on both the inner and outer surface, whereas your glasses are just moving through the world with you. Because they are facing the world, I would say that you should consider cleaning your glasses more often and washing your hands after touching them. But I don't think they have the same risk of masks, of basically being a virus catcher or virus concentrator.
Okay, we have time very briefly for one more. We're aware of how sensitive a dog can smell. Some have been trained to sense cancer. Will we see a time when they may be trained to detect coronavirus?
That's actually a really interesting question. I did just see something that there are some studies that they're trying to do with a cohort of dogs that have been trained to sniff the urine of COVID patients and identify them. And if they can verify the training of the dogs, they're going to move on to start testing patient samples that way. But in all of the dog studies, it's clear that they can sense, metabolic or other derangements very, very sensitively, but the standardization between dogs has always been a problem. So I will also watch that with interest.
That sounds like a good story. Thank you very, very much, Dr. Saxinger.
My pleasure. Thank you.